Well, good afternoon, everyone. Thank you for joining us. I'm Carrie Baird. I'm the CEO of Flagler Cares. Welcome to our virtual coalition meeting that we have each quarter. Thank you for joining us today. I am recording the meeting today. There were quite a few people that were interested in this topic but weren't able to make it. So hopefully you got that notice when you logged on. I'm going to show you the agenda today. We are going to focus today on Medicaid unwinding, which some of you may have heard of or not, but we think it's a pretty important issue for our community to make sure that our customers and clients don't have a lapse in coverage when Medicaid changes are coming soon. So we have invited Patricia Grogan from Department of Children and Families to come speak today, and I do see Patricia is here. And Patricia, I can make you presenter if that works, and then you can share whatever you would like to share.
Okay. Yeah, I'm not sure I'm going to need to be sharing anything today, so
okay.
I think we're good.
Then I will take it. Well, thank you. Welcome, and thank you for being here today to share an update on Florida's view on Medicaid unwinding. We're looking forward to hearing more information from you and then having some discussion about how we can get ahead of the process.
Okay, are you ready for me to begin now, or do you?
Yes, please.
All right, jumping right in. Good morning, or good afternoon, I guess. I'm Patty Grogan, and I am the Director of Policy and Programs for the Economic Self-Sufficiency Office of the Department of Children and Families, which barely fits on a business card. Our program oversees all aspects of food assistance, cash assistance, and eligibility for Medicaid, as well as other programs for people trying to achieve economic self-sufficiency, including the refugee assistance, homelessness assistance, rental assistance programs, relative and non-relative caregivers, and a variety of other small programs. But Medicaid obviously is one of the largest programs for which we determine eligibility. I wanted to talk with you today about a little bit about our Medicaid unwinding plan. Unwinding is the term that the federal government has been using to describe what we do after the public health emergency ends. Now, we're not sure exactly when that's going to be, but probably sometime relatively soon. We are engaged in outreach to a lot of critical stakeholders like yourselves to provide you this overview, to look at the direction of the state and encourage you to join us in helping communicating with our clients over the next year. To give you a little bit of background on the public health emergency, in March of 2020, the Secretary of HHS declared a public health emergency related to the COVID-19 pandemic. At right about the same time, Congress passed the Family First Coronavirus Response Act, which put in place some significant protections for Medicaid recipients. It really did two important things in regard to Medicaid. First, it increased the Medicaid assistance percentage, what we call the FMAP, or the federal share of Medicaid cost, by 6.2%. At the same time, it required what's known as continuous coverage. So states could not make it harder for anyone to enroll in Medicaid or disenroll anybody from Medicaid during the length of the pandemic, regardless of whether there were changes in individuals' eligibility. So unless you died, moved out of the state of Florida, or specifically asked to be reviewed, if you were receiving Medicaid in March of 2020 or became eligible for Medicaid at any time since then, you will have remained on Medicaid coverage since March 2020 or the date you became eligible. In just last month in April, HHS extended the public health emergency for another 90 days until July 15th, right now, of 2022. CMS, the Center for Medicaid and Medicare Services, has also promised that there will be a 60-day notice of the end of the PHE. So right now today, we are about 6 days away from that potential notice if indeed the public health emergency will end in July. So we are waiting with bated breath to know whether or not it will end in the next 6 days. Well, we should get that notice. If we hear nothing, then it will not end on July 15th. If we hear nothing, we'll be waiting every day essentially until there is some indication that the federal government will continue or will end the PHE. At a minimum, because we have not received notice before now, no one will lose Medicaid coverage before August 1st. That would be the first date that anybody would be affected. As a reminder, the Department of Children and Family only determines eligibility for certain Medicaid recipients. The Social Security Administration determines eligibility for SSI recipients who are then categorically eligible for Medicaid. And we do not administer the Medicaid program. We just determine eligibility, and the rest of the administration is left to the Agency for Healthcare Administration. But to give you an idea over the last 2 years what kind of impact this has had on the Medicaid program, we've seen an increase in the number of clients determined eligible by DCF from 3.2 million to 4.2 million people. There's really two reasons for that. One is, of course, there has been some economic displacement, which has allowed more people to become eligible for Medicaid. But the bigger factor is that once approved, people have continued to be eligible, even if their income changed or their family circumstances changed. So when the PHE ends, whether that's in July or at some other date, there are a number of people who are likely to be affected and may no longer be eligible for Medicaid. Specifically, those groups are most likely to be families who have had an increase in income, families whose youngest children has now turned over the age of 18, youth who are 19 and 20 years old, former foster youth who have turned 26, and aged and disabled individuals who are now eligible for Medicaid. Nationwide estimates are that may be up to 15 to 20% of the Medicaid enrollees. There's also another group that may not be ineligible based on the factors of their personal circumstances, but it's people who don't complete their recertification when their Medicaid date ends. When they come up for review, there's always a significant number of people, can be as high as 30 to 50%, who don't turn in their documentation and complete their Medicaid renewal. So that's the task that we have in front of us over the next 12 months. In order to complete that task, we have been continuing to receive three very different sets of guidance from CMS and the federal government. One starting in December of 2020, and the most recent set of guidance received in just March of this year. Currently, the federal rules allow the states 12 months to regularize their Medicaid population. So we would have 12 months to review the eligibility of all 4.2 million people. Now, that sounds like a big task, and I'm not, it is a big task. It is certainly something that is of concern, but Medicaid renewals normally occur every 12 months. So to a certain degree, this is sort of business as usual that we would do redeterminations anyway. But throughout the public health emergency, DCF has focused really on two specific populations that we are paying attention to. One is the individuals who we know are ineligible, or at least they were ineligible at our last interaction with them. And at this point, we know there are at least 550,000 individuals who at their last review did not meet the current eligibility criteria. But additionally, we have over 600,000 people who, when their last review came up, did not complete their redetermination. So they simply did not respond to or complete the process. We don't know what their eligibility is, and we don't know if they will complete the process when they're contacted again. There's a lot of reasons that people may not have responded. Some may have other healthcare coverage and are no longer interested. Others may have moved. Or others probably know that their Medicaid wouldn't change under any circumstances, so why bother? So this is a group that we don't know what their ultimate eligibility will be. So how are we going to do all this? I know that's one of the issues that people are most concerned about. How all is this going to happen? And one of the things that the CMS has allowed us to do is have a little bit more flexibility than normally we would in how we are, and how we can schedule our redetermination process. We're allowed to move dates in a way that we would not normally be allowed to do so. So what we are doing is trying to use that flexibility in a way that will both promote efficiency and effectiveness within the program and make it easier for our clients. Right now, many families who receive both Medicaid and other benefits, or have more than one person in the family who receives Medicaid, may end up with different dates of their redetermination. So for example, a mother may have a redetermination in February, then the family has a SNAP review in July, but the children's Medicaid redetermination is in August, and then another SNAP redetermination, because of every 6 months, would be in December. So that's 4 times that family would have to interact with the department, and which can be obviously a lot of work for a family to complete. So where possible, we are going to align all the Medicaid, SNAP, and other benefit dates that we can into the smallest number of redeterminations allowed, so that we can get the whole family at once for all of their benefits. Now, it won't be possible in all cases, because we're not going to be shortening anybody's current Medicaid period, and we can't move their SNAP dates, but wherever possible, we'll bring them in together at the same date. At the same time, we're also going to use this flexibility in rescheduling to change the distribution of our case reviews. As you may imagine, in some months, we have a much more significant number of cases coming for review than we do in others. For example, when the federal marketplace is active, we see a lot more applications and therefore a lot more redeterminations. While certain months, like August, we tend to have a reduced number of applications and redeterminations. So we're going to use this opportunity to spread out on a more equal basis all of the redeterminations, so each month we'll have hopefully close to the same number. In addition, we are trying to identify special populations that need particular accommodations based on who they are and what impact may have on their redetermination. For example, the people who become eligible for Medicare and will need to, if they are no longer eligible for Medicaid or need to go and apply for Medicare first, we're going to schedule all of those redeterminations in January, so then they will have access to the Medicare open enrollment period and not see a gap in service. We're also working with the Agency for Healthcare Administration to implement the postpartum extension, where in the 2021, the Florida legislature extended eligibility for postpartum women for 12 months. And right now they haven't needed that, because anybody who received Medicaid for the birth would continually be eligible. But we're going to ensure that the implementation of that occurs, so all postpartum will have at least 12 months of coverage. So we have a lot to do over the next 12 months. And we have a lot of different strategies that in order to make this as easy as possible on clients as well as the department. We began in January doing extensive communications and outreach with our clients, trying to ensure that we have updated addresses. And this is one of the biggest concerns. A lot of people have moved over the last 3 years, and people tend to move anyway, and don't always think about the Department of Children and Families as one of the first people to notify. So since January, we have been asking at every interaction with our call center and with our caseworkers that everybody we interact with updates their address. We're also encouraging our managed care Medicaid plans operations to do the same thing as they're interacting with clients, and ensuring they don't only change their address with their doctor or with their MCO, but also with the Department of Children and Families. Additionally, we're right now engaged in a process where we're going to work with our EBT vendor as well as our managed care organizations to identify all of the different addresses that they have for our clients. And if we identify a different address from any of those individuals, we'll send postcards to all of the addresses suggesting that people come back to our website and update their address. A second concern that we have is people simply paying attention to their Medicaid renewal notice. So we've been trying to find ways to make sure that the envelope that notice is in, that it's time to renew, stands out among the other mail. And first we talked about doing a special colored envelope, but we found the supply chain probably couldn't accommodate our need for 3 or 4 million envelopes. So we're doing something a little bit different, and we're looking right now at including a yellow stripe on the envelope that will say, that will indicate it's a renewal notice, and that will have a media campaign focusing people's attention on that. For clients who are ineligible, because as I said, some people will simply no longer meet the eligibility criteria, we'll continue our existing processes to do automatic referrals to both the federal marketplace or to Florida Healthy Kids. The concern there is we need people to know that they do have to take actions with those providers. For example, if you go to Florida Healthy Kids, you have to pay a premium. If you go to the federal marketplace, you have to select a coverage and enroll. So we want to ensure that people are aware of their options, that they may be eligible for subsidies, but they do have to take additional action even if we do an automatic referral. Right now, the Urban Institute estimates that something in the range of 66% of children who may lose Medicaid coverage will be eligible for coverage through either of those two options. So we think there is coverage available for children, so we particularly want them to take advantage of it. So there's a couple things that we think that you can have an important role in and can help us with. First of all, we'd like you to keep informed. DCF has on DCF's website, we have a sign up for DCF emails alerts that you can go in, put your email address in, select Medicaid as your issue of concern, and that we will have an ongoing communications campaign as the unwinding process moves forward. That will help you to keep informed of everything that we're doing in the coming months. The next most important thing is to help your people that you interact with update their address. Make sure they update their address with DCF, not just the managed care organizations or their medical providers. To the degree that you know that clients receive Medicaid, remind them to recertify. When you see our yellow envelope campaign go forward, make sure you're telling people to look for it and help them if they need help to complete their application and send in documentation if needed. We also know that all of this process is going to increase the number of calls coming into our already overburdened call center. So the legislature has given us funding to hire 137 additional call center employees over the next year. But even then, we anticipate that when this becomes public and everybody is concerned about their Medicaid coverage, the call center may be inundated at the beginning particularly. So we would ask you to communicate to your clients that if they do need to call our call center, to do it strategically. I want you to think about how many of you came into the office today, Monday morning, with a list of things that you needed to do. Schedule a dentist appointment, sign up your kids for summer camp, whatever it is. Everybody comes into their office Monday morning and wants to do that. My advice to people is never to call a call center on a Monday morning because everybody else is. The same situation with us. Our highest volume is always Monday mornings, and so it is the least time people are likely to be able to get through quickly. So we'd suggest that people call, when the call center opens up at 7 o'clock in the morning, not at lunchtime necessarily, because that's also not a great time, but to try to work with you to remind people to try to schedule their calls if they can at our lower peak times. So our goal is to help all of our clients who are eligible to remain enrolled. And that's a very simple goal over the next 12 months. And to those who are not eligible, to refer them to other options for which they may receive medical care. We've tried to arrange our plan in a way that will do that efficiently and effectively. We do anticipate taking the entire 12 months that we have available to us. And we hope that we can do it in a way that keeps most of our clients enrolled and engaged with us. Questions?
Thank you so much. Are there questions for Patricia?
Patricia, this is Carol Matson. I work for Flagler Cares and I came from DCF. I just have a question about the email notifications. I know that they can turn on their email to receive their notices. Is this something separate on the website now?
No, this is not a notice for like a client that your personal notification of your eligibility. This is a general email that we'll be sending out, for example, saying the public health emergency has ended and here's how we're communicating. Here's an example of the postcard that we're sending out. Here's tell your clients to look for the picture of this envelope. Here's our social media. This is really to keep people like you engaged and involved on what we're doing.
Okay. Thank you.
Mm-hmm.
Other questions? I have a couple.
Sure.
So, you know, hearing your feedback about the call center and the likelihood that those challenges of reaching someone will continue, are there ways that people can recertify completely virtually by going to their account online and sending information in, or?
Oh, absolutely. 95% of our clients do all of their recertification online, and we have set up everything so they don't have to contact the call center. We've actually done a number of things with our artificial intelligence bots that can help you ask you little questions on what you need and can direct you to answer those questions so you don't have to go try to call and get some general information. So we have, and we've actually done quite a bit to improve the bots. Beginning last fall, we implemented a new system that would allow a notification that if a client has sent in backup documentation, it is identified and put into the queue of its case and sent to the caseworker. If we get returned mail, we're working on another bot which should be implemented before the 1st of July, which will then do an email or text notification to people saying, hey, your notice was returned in the mail. You need to come online and change your address and do your renewal. So we're trying to use as many ways to communicate people as we can. Again, particularly we're concerned about return mail and people not even knowing that they're up for renewal.
Very good. And how about, I imagine one of the challenges is people like myself don't remember passwords and usernames. Is there a way that someone could try to reset their username or password without calling the call center? Is that something you can do online?
Yes, you should be able to do that online.
Okay. And how about for customers who really aren't going to be able to navigate online? Are there on-site locations throughout Florida that individuals can make appointments and go in and see someone?
Yes, usually we don't even need appointments, that most people can just walk into our storefronts, but we also have a number of community partners that are on our website all around the state who are working to help clients and engage and enroll in all of the programs, not just Medicaid. In particular, and also the managed care organizations are very much interested in helping people re-enroll as well. So there's lots of resources for people who may be in need of assistance. But I will tell you that probably more than any other state, Florida's online system has probably the highest utilization of any state, both for applications and renewals.
Very good. And I'm glad you mentioned community partners. I looked the other day and there are none in Flagler County. Is it possible to become a community partner if there are organizations that were interested?
Yes, we're just about to open that process. I think this week or next week, there should be some additional opportunities for you.
Very good. Right. Well, thank you very much. Other questions for Patricia?
Patricia, this is Carol again. I do have another question. Have they thought about extending the call center hours?
It is an issue that's under consideration. As you probably are aware, just like everybody else, staffing issues are problematic in terms of trying to hire people.
Absolutely.
Well, trying to hire people right now is a little bit more complicated, so it's always under consideration, assuming we can bring the staff in to man it.
And are their current hours 7 to 6?
Yes.
Okay, thank you.
Mm-hmm.
Since this relates to kid care, who is available to help families navigate that system in our community, kid care? Is it all also online?
Well, Kid Cares actually uses our application and our logic to determine their eligibility, but they also have a separate website that you can contact for additional assistance.
Very good, thank you.
And Carrie, we have a couple of staff at ELC that went through the Kid Care application process training, so families can contact us if they have any issues with that.
Great.
Very good, thank you. So Kim with early
Yeah.
learning.
Hi, Carrie. This is Jeanette with Healthy Communities.
Jeanette.
We do families locally in Volusia County with the Healthy Kids and Florida Kid Care. Martha and I, we can assist them, and we speak Spanish as well.
Thank you. Did you say Volusia and Flagler or just Volusia, Jeanette?
They can call us over the phone. We do for Volusia, but if they don't find anybody in Flagler, I speak Spanish. We can help. I have helped many families that they don't have any assistant, and they can call our office, and I can help them.
Great,
Thank you.
thank you. Are there, just out of curiosity, are there other organizations who've been trained to help people navigate these systems at all, besides Early Learning Coalition specifically, and Healthy Communities?
Are you asking me?
No, I was just asking. Just wondering who else is out there.
Carrie, this is Laura, Days of Health. We have the CACs we're supposed to have them at all of our sites. Right now, we've got some vacancies. But so those folks can help with the marketplace enrollment with Medicaid.
Carrie, this is Joyce from the Health Planning Council. Of course, we have subcontracts with Flagler Cares to do the navigating program. We're a little different than the certified application counselors in that we have a little bit different training that we can also help with complex situations and help people also with enrolling in Medicaid. I'm not sure if the CACs do that, but we're available, and we have a contract with the University of South Florida, so we're available to do that year round. We also, there's a new SEP this year, so folks that are between 100 and 150% of poverty qualify for enrollment in the marketplace year round. And so a lot of these folks that may find out that they're no longer eligible for Medicaid also will qualify for an SEP because they will be losing insurance coverage technically, and so they would qualify. But the goal is to get them coverage when their Medicaid stops, that the health insurance marketplace coverage would start like the next day. So we really want to capture these folks early, and we can actually enroll them. If we know the date that their Medicaid is ending, we can actually do the application and enroll them in advance of their Medicaid ending, up to 60 days in advance of their Medicaid ending, so that when the Medicaid ends, the very next day, the marketplace insurance would kick in. So I encourage everybody, if you don't know me, or you can contact Flagler Cares. Carol was on the line earlier, and contact her, or the Health Planning Council. We have navigators throughout a 7-county area, going from Volusia County all the way up to Nassau County.
Thank you, Joyce. Any other questions for Patricia?
Hey, Carrie, this is Carrie from ElderSource. ElderSource, hi. We're also a partner agency, and we have an enrollment center which helps people enroll in SNAP and in Medicaid and all the MSP applications. And we also help them to recertify. And we help in all 7 counties, starting from Baker all the way to Volusia.
Very good. Thank you.
Well, thank you very much, and we very much appreciate all of the work you all are doing in the community. You know, there's going to be a lot of interest and concern over the next 12 or 14 months. We appreciate all the work you do to help people.
Thank you so much for being here, Patricia. We really appreciate it.
Certainly.
Very good.
How will we know if Patricia, did she leave? How will we know if she gets that notice in the next 6 days?
Well, I imagine you'll see it in the news. It will not be quiet if they determine that they're going to end the PHE. I'm sure it will be in the news.
Okay.
Yeah.
Thank you.
We will try to keep our ears to the ground, whatever that metaphor is, and make sure that we send it out on Community Connector when we hear about it, along with any other notices that come out, so that we can really make sure that our clients have been given the information as many times as possible from as many people as possible, so that they really pay attention. Yeah.
Great,
Thank you.
thank you.
Thank you. All right, we have a little time for announcements. So I'm just going to start us off a little bit. Hopefully you've received notice about the Health and Human Services Summit that will be on Wednesday, starting at 9:30 until 3:30. It's free to all attendees. We have over 70 nonprofit and governmental exhibitors that will be there sharing information about their programs and services. We also have concurrent trainings that are going on, also free. Several of them are offering continuing education credits, so hopefully you will be joining us and take part in those opportunities. Also just wanted to make sure that everyone is aware of the Community Connector. It's a really great way to make sure that you know what's going on in our sector. We send out messages to thousands of people every day, so it's free to receive Community Connector. You just have to go to either Flagler Cares or One Voice for Volusia website and sign up. Also just wanted to reiterate and have Carol jump in. Flagler Cares is a partner with Health Planning Council on the health marketplace, and we are definitely ready and willing to help anyone who might be losing Medicaid coverage, ensure that they have continued coverage. Carol, do you want to just make a few comments about how we connect with clients?
Absolutely. So when someone calls and they need help with their Medicaid or with marketplace insurance, we take a look at their income and discuss what's the best option for them to enroll. And we follow up with them with the Medicaid and the marketplace to make sure they're happy with their selections. We're keeping track of the PHE and when it's ending, so that we're ready to roll with this, so no one is without health insurance.
Thank you, Carol. Are there other announcements that people would like to make? Kim, do you have an announcement?
Yeah, I couldn't find that.
On your face.
Sorry. I'm like, where's the button? Just again, in terms of school readiness assistance, if you all have families that are in need of assistance or think that they may or may not qualify, to please have them contact us. Especially in Flagler County, our school readiness enrollment has decreased. And I think there are many families that may be paying for childcare each week that could possibly qualify for childcare assistance, that don't know that they do. So we're really pushing some outreach opportunities in Flagler County to try and connect families that already have their children enrolled and families that may not know about our program. So again, if you have, if you're working with a family that's, in need of childcare, just at least have them call us. Aside from the school readiness program, we do offer, Help Me Grow, which can do the free screenings for children. We have CCR&R services. So there's a lot of things that we can help connect families to. So if you're working with a family with a child, at least give them our contact as a resource, please. And if you know anyone that is interested in becoming an early childhood teacher that has a passion for children and teaching, our childcare programs need children. Childcare programs are having to close classrooms because of lack of teachers in the classroom. So please, if you know anyone looking for that and has a passion for children, to again, let us know. Thank you.
Thanks, Kim.
Can you share that contact information
Yes.
for your school readiness program?
Yep. I'll put it in the chat and then Carrie, can I just email? Okay, I'll just email it to Carrie. Thank you.
Yeah, we'll share that. Any other information to share or questions?
Carrie, will the presentation be on your website or will it be sent out?
The recording of this meeting, Christy, which?
Yes. Like because of the presentation, I'm just wondering.
Yeah, it's, I'm pretty sure GoToMeeting will let me do a variety of things. So we'll include a link, but I think we can also put it in another format and put it on our YouTube channel. So I'll make sure that everyone has access to that.
Thank you.
Sure. Any other announcements or information to share? All right, well, thank you all for joining today. Our next meeting will be August 8th at 3 o'clock. If anyone has any suggested topics or speakers for the meeting, please just let me know, send me an email or give me a call. And hope you have a great rest of your week and hope to see some of you on Wednesday.
Thanks, Carrie.
Thank you.
you.